for your head. Okay. If that were to be present, we would want it to go away at 45 degrees. So first thing I'm gonna do is listen to your heart sounds. I'll listen with both sides of my stethoscope. With the diaphragm, we're listening. It's for things that we want to hear, so I should hear a normal like lub dub sound. And then when I listen with the bell, I'll be listening for any heart murmurs. So the first is at the second intercostal on the left side of the sternum. This is the aortic. Okay, and then second intercostal on the left side is the pulmonic valve. And then third intercostal space, sorry,
it's okay,
is Erb's point. Okay, and then fourth intercostal space, if I could have you actually do it, thank you. This is the tricuspid valve. And then the last spot is your mitral valve, which is fifth intercostal and is over to the side. I'm going to take your apical pulse here for a minute. Okay, and your pulse there was 72. So now I'm going to go back through and listen to each one with the other side of my stethoscope, listening for any heart murmurs. So back to the aortic, pulmonic, Erb's point, and then if you could lift your breasts up, tricuspid. Sorry, my hands are cold.
That's all right.
And then mitral again. Just okay, everything sounds good.
Heart and your lungs. Okay. I'm just gonna start by feeling around on your chest, make sure I don't feel anything. I also don't see any lesions or anything, which is good. Have you had any lumps or anything that you've noticed in your chest area?
No.
Okay. Does any of this hurt?
Mm-mm.
Have you had any problems with breathing at all?
No.
Okay. So this looks good. I don't feel any lumps, masses, and if you're not having difficulty breathing.
Mm-hmm.
So I'm gonna start by listening to your heart. I'm gonna go down. I'm gonna ask you to lift your breast. I'm gonna listen. I'm also gonna feel pulse down there, and I'm just gonna come right back up.
Okay.
And then we'll listen to your breathing sounds.
Okay.
Okay. So I'm gonna listen with this side first, and then go to this side.
Okay.
So just relax, breathe normally. Okay. Okay. Okay, and if you would just lift your breast for me, just real quick. This one down here. I'm going to flip this. I'm going to take a quick pulse just to see if I feel your apical pulse. Okay, I'm going to listen to the bell now. One right here. Okay. Okay, everything sounds really good. I'm not hearing any signs of heart murmurs. Everything seems very smooth. It seems like it's getting to all places of your heart. So I'm gonna move on to your breath sounds now.
Okay.
So what I'm gonna do is I'm gonna do 4 up here, and then I'm gonna go to the back and do another 4.
Okay.
I just ask that you take strong deep breaths, and if you get lightheaded at any time, let me know and we'll take a break.
Okay.
Okay. Okay. And deep breath. Okay, deep breath. Okay, I'm gonna go under here. Deep breath. And another deep breath for up here. Okay, still feeling good? Yep. Okay, I'm gonna go to the back. And a couple more back here.
Okay.
Okay, so another deep breath. Okay. Couple more. Another deep breath. One more deep breath. Okay, that's perfect. I didn't hear any wheezing. I didn't hear anything out of the ordinary. No crackles. It was just a great in and out breathing sound. So I'm back here. I'm gonna do a quick expansion test. So I'm just seeing if your lungs and your rib cage are moving correctly with your breathing.
Okay.
Okay. So if you take one deep breath for me. Okay, that looked good. Did that hurt at all or anything?
No.
If you just set up or pull up that arm for me, I'm going to take a quick AP diameter. So I'm just making sure that this is half this, which it looks really good. So you can relax. I'm going to actually come to the front and we're going to do one more expansion test on your anterior ribs. So move in and oh, perfect. So now that we have all that done,
Your thyroid, so don't be alarmed. I'm reaching around your neck. Just feeling everything feels good. Next, I'm just inspecting your back, looking for any moles or lesions, something to be concerned about. But I do not see anything. Next, checking your spine alignment, which is good, straight. Everything's good. Now I'm going to percuss in 12 different spots on your lungs. Actually, first, I forgot, I have to do your chest expansion and your 2-to-1 ratio.
okay.
So if you could just breathe deep for me. All right, chest expansion is equal on that side. And then if I could just do, putting my hands right here at your sides and then at your front, which means that you have a 2-to-1 ratio, not a 1-to-1, which would be indicative of COPD or barrel chestedness.
Okay.
Now I'm going to percuss 12 different spots on your lungs.
Okay.
Starting up here. And I am noting resonance. I'm just going under your broad here. And 2 more. All right. Heard resonance when I was percussing, so now I'm going to auscultate and listen, hoping for clear lungs, listening with my diaphragm. All right, and then if at any point you need a break from this, just tell me. Just take deep breaths. All right, and last 2. All right, you feeling all right after that?
Yep.
All right, then I'm just gonna have you laid down for me so that we can do a cardiac assessment. All right, and are you fine with me undraping you for?
Yeah.
All right, perfect. So first thing that we're gonna do is assess for JVD. So if you could just turn your head that way, don't see anything, and then towards me, don't see anything on that side. So perfect. Now we can get started with the heart assessment. So I am going to be listening with my diaphragm and my bell. I'm going to be listening with my bell for murmurs. All right. So first place that we're going to start is your aortic, which is on your left side, or on your right side, 2 intercostal spaces down. So 1, 2, about right there. Listening with my bell, or my diaphragm first. Okay, and then putting my finger there, flipping it over to the bell. All right, perfect. Now going to your left side, I'm going 2 intercostal spaces down to your pulmonic. So 1, 2, right there. I've already flipped to my diaphragm. Okay, and then just flipping that around. All right, great. So flipping it back around to my diaphragm. I'm at the 2nd intercostal space right now, or the pulmonic. If I go 1 down, 2nd, 3rd, right about there is gonna be the herbs. I've already flipped it to the diaphragm. Putting my finger there, flipping it around, listening with the bell. Okay, perfect. So I'm at the 3rd intercostal space right here. So if I go 1 down, sorry, going underneath your brow, right about here is going to be your tricuspid. So already flipped it to the diaphragm. Just gonna take the gown down a little bit more, put it underneath your bra. Great. Hearing that lub dub, which is what we want to hear, no extra sounds. Keeping my finger there. I'm gonna move to the bell. All right, perfect. And then I'm going to move 1 space down from your 4th intercostal space, which is your tricuspid, to your 5th, right here, which is your mitral. So I'm gonna flip this around to the diaphragm. And I'm going to count this for a full minute to get your apical pulse. Okay, so I got an apical pulse of 72, which is normal. All right, now for privacy, we can rate your heart, okay? So, there it is. Aortic, pulmonic, I'll put your breath in. If you'll just take a deep breath. Get the back. It's okay. Just take a deep breath. Get the lateral breath sounds. Get the other side. Okay, thank you. Could you just take your shirt off for me? We'll go ahead and assess your skin trigger. And I'll just pinch real quick. Skin trigger is less than 3 seconds. And since you're a woman, I would tell you, I would pick a day out of the month, maybe like the day your birthday falls on every month, to stand in front of a mirror without a shirt or bra on and look at your nipples and make sure they're not inverted or there's no dimpling. I would check if there's any masses that can be seen visually. I would use your 3 middle fingers and the pads to rub down to feel for any of those masses or abnormalities, anything like that that's not normal. And then if there is any, of course, I would ask you to call the doctor because that's not normal. Then I'm going to ask you to stand up. If you could just bend over towards the windows and the vertebrae is midline and straight. Okay, you can sit back down on the bed. Thank you. And now, if she was in a hospital bed, I would raise it to 45 degrees, ask you to look to the left. And 45 degrees, you can see if there's any JVD, which none is present. Then I'm going to ask you for your arm, and I would block off the radial and ulnar arteries and clench your hand in a fist. And it's turning white, and then open up, and it's red. So blood flow is good. Okay, and now I'm going to listen to your heart. Okay, so we have the second intercostal space, the aortic, second intercostal space, pulmonic, third, herbs. I'm going to lift under your bra. Tricuspid. And mitral. Okay. Now I'm going to listen for any heart murmurs in the same spots. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. Okay, and there was no heart murmurs present, so then I'm going to assess your lungs. I'm going to get to the side. We lift your arm up real quick, and you are good 1:2 AP ratio. So now I'd ask you to stand up, and if you could say 99 repeatedly.
99, 99, 99.
Okay, I'm going to do your back. I'm going to go in the middle of your back. If you could, again, say 99, 99.
99, 99, 99.
Okay.
So now after the 99 test, I'm going to do a W in the middle of your back. Could you take a deep breath for me? Breathe out. And then I'm going to do it on the front as well. Deep breath. Okay, perfect. Now you can sit back down. Now we're going to listen to your breath sounds. The top of the lung. Just take a few deep breaths for me and breathe regularly. You just raise your arms up for me. Take a deep breath. Okay, I'm gonna listen from the back. So if you just wanna get right here so that you can see. Okay, same with the back, the top of the lungs. Deep breath. Deep breath. Okay, all her lung sounds were clear. So now that I've assessed your
Heart, the first sound I'm going to listen to is the aortic. It is the right sternal border. It is the second intercostal, and it is at the base of the heart. Next is going to be the pulmonic. It is also the second intercostal space. It is also at the base of the heart, and then it is the left sternal border. Third is Erb's point. It is in the third intercostal space. It is also the left sternal border, and then that's where you hear murmurs. Fourth is tricuspid. It is in the fourth intercostal space. It is left sternal border, and then it is at the apex of the heart. And fifth is going to be the mitral. It is midclavicular, also at the apex of the heart, and it is in the fifth intercostal. Okay, there were no murmurs that I heard, and it was a strong heart tone. And so S1 and S2, S1 is at the apex of the heart. S1 is the apex, so it would be tricuspid and mitral. And then S2 is at the base of the heart, so it would be pulmonic and aortic, and then Erb's point is where you hear murmurs. So next I'm going to look at do her heart rate. So her heart rate, when I was listening to it, it seemed regular, so I'm going to count to 30 and multiply by 2. Her heart rate is 39, so times 2 would be 78. Yeah, 78. And then that is in between the parameters of 60 to 100 for a normal heart rate.
A lot of rise and fall. So I'm going to ask you to take your shirt off. So now I'm going to check for transverse A and P, and you are 2 to 1. That means you're not barrel chested, and that's good. The next thing I'm going to do is I'm going to look for any scars or lesions anterior and posteriorly, and I do not. And I'm going to look at your hair. Your hair is thin, fine, villous hair. That's good. The next thing I'm going to do is I'm going to look at your skin of your thorax and compare it to the skin of your neck, hands, and wrists, and it's all the same, so that is good. The next thing I'm going to do is I'm going to look at your mouth. Your lips are pink and moist, and there's no cyanosis. Now I'm going to ask you to open your mouth. Your buccal mucosa is pink and moist, and there is no cyanosis. The next thing I'm going to do is I'm going to look at your hands. Your nails are slightly convex, and they are pink, and the capillary reflow time is less than 3 seconds, and there is no cyanosis, so that is good. Now I'm going to ask you to make a diamond, and I do see a diamond. That means there is no clubbing, and it is less than 160 degrees. So now I'm going to palpate your chest. I do not feel any crepitations, and now I'm going to check your chest expansion. I'm going to ask you to breathe. Okay, now turn around. Okay. So your chest expansion is equal and symmetrical bilaterally. So that's good. The next thing I'm going to do is I'm going to auscultate your breath sounds. And the only thing I ask is that you breathe through your mouth and you breathe heavily. Okay. Okay, so now I'm going to talk about what I heard. I listened to your bronchial breath sounds, and those are located over your trachea and your larynx.